youngest client is 13 and my oldest client is 73. I see men, women, all genders, and people from a variety of racial and ethnic backgrounds, different socioeconomic statuses, people in cities, people in suburbs, and people in rural communities. And I see clients who they simply need someone, a mental health professional, to talk to in an objective, non-biased way, someone who can provide them safe space and a listening ear. But I also work with people who are grappling with symptoms of mild depression and mild anxiety, to people who are coping with serious illnesses, mental illnesses such as schizophrenia or bipolar disorder or even borderline personality disorder. And so my clients, they range, they're across the spectrum as far as what's needed to meet their mental health needs. And so with that said, I've found in my years as a therapist and as a university professor that a lot of the things that we know in education can definitely be applied to what we don't know in mental health. Similarly, a lot of what we know in mental health we can apply to education, or what we think we know in education that's definitely not working for the majority of the population. So the purpose of Planet Venus is to actually bridge my worlds, and I bridge all of my worlds as a university professor, as well as my role as a mental health professional. And I use education to inform mental health, and I use mental health and my background in mental health to inform what we know about education. But the purpose of Planet Venus is to teach everyday people how to engage in self-healing practices. And I talk about this from both a race and gender perspective, but overall a cultural framework. And so you're probably thinking now, so what am I going to learn from this channel? Well, I can't give you a definite response about what you will learn. But the one thing I can tell you, you probably won't learn a lot about makeup or beauty or fashion. As you can see, I'm not really into those things, although I do enjoy those things. I love it. I love it. But I also believe that we can use YouTube and other channels and other social media to help people heal. Yes. So I believe that we can teach people how to heal through community, right? By establishing a social media community, or community here specifically on YouTube, to help people, to teach people how to heal from race-based trauma, how to heal from and resist chronic stress. So in my work, I specialize in race-based trauma. So I work with survivors of sexual violence and abuse, and I also work with adult survivors of childhood domestic violence or childhood domestic abuse, in particular sexual abuse. And so all that I want to do is I want to bring these conversations that I have with my clients or my students behind closed doors, and I want to make them more publicly. So I think we need to move past thinking that the only way people can heal is in some private space, right? So even when I'm in a private space, which I do value and I do see the benefits of therapy, I can only serve one or a few people at a time. So I do see in my private practice individuals, I see families, and I see couples. And it is my job to help them navigate whatever problems or challenges or issues that may be inflicting them at that time. But I also know that reaching one or a few is not enough. I mean, if we just look at the demographics within the United States, we will see that the majority of African Americans, for example, simply don't have access to affordable health care. So without access to affordable health care, then of course people are not going to have access to affordable, high quality mental health services. And so a lot of people, we're in a movement right now to destigmatize mental illness and also to be champions or advocates for access to mental health services, especially for Black and brown communities and other communities where people have been marginalized and they suffer at the hands of racism, capitalism, and patriarchy or sexism. And so I know you're thinking, wow, she just got a little political. So now you just got a taste of Planet Venus. So here on Planet Venus, we do not pretend that everything is equal. We know that certain groups of people have definitely been subjugated and oppressed in this country, and that affects our mental health. But on Planet Venus, what we're really interested in is how do we heal? How do we heal and how do we resist trauma, especially systemic trauma or trauma that's interpersonal as well. So we don't ignore the stressors that occur in our families, our communities, our schools, and our workplace. So on Planet Venus, I will bring you, I will help you come to a self-awareness about your own healing. I will help you understand the relationship between self-knowledge, self-awareness, and cultural practices and the healing process. So I give specific attention to transgenerational trauma, radical self-love and radical self-care. What does that look like? Okay, so I'm giving out trade secrets. I'm going to offer you these helping tools. Again, it's not a beauty channel. It's not a fashion channel. It's not a hair channel. So sometimes I won't always look pretty and I will not always talk pretty, but I will tell you, I'm not going to say tell you because now it sounds so authoritarian, but I will help you. I will help you by offering strategies, healing strategies, and talk about how we can use our mind, bodies, and spirits in our environment. So what's around us to heal ourselves and to heal others. So I'll be providing tips on cultural knowledge. Okay, I'll give you more insight into what I do as a mental health professional, especially as a Black woman mental health professional who works from a cultural lens, right? So I have to tell y'all now, I am unapologetically having conversations from a Pan-African and Afrocentric perspective. I am unapologetically, unabashedly having these conversations from an Africana womanist perspective. Okay, so I know a lot of you are probably thinking, what does this mean? What does this mean? It means that I do rely on a lot of traditional or indigenous healing practices to heal myself and to heal others. But it also means that I understand that the healing process needs to be culturally infused, right? So meaning we have to turn into ourselves and how we speak and how we think and how we walk the earth to help heal ourselves and to heal others. So we don't have to wait, to pay somebody $40,000, $50,000, $60,000 to begin healing ourselves through somebody else's educational systems. We can take the education that we know it's within ourselves, the education that we've learned from our grandmothers, our mothers, our fathers and grandfathers, our aunts and uncles, in our own communities to begin to heal ourselves. So we're talking about some of these secrets that have been passed along, but we've been taught to forget. So with that said, again, this is Planet Venus. My name is Dr. V. Come and join our community. Make sure that you subscribe to our YouTube channel, and make sure that when you show up, bring a pen, pencil, journal. Yes, grab your favorite journal and get ready to do the work. Okay, so let's get it in, y'all, and let's heal ourselves to heal our communities.